Hey guys, it's Pharma Files. Let's talk about coeliac disease, a condition that is often undiagnosed, yet it can have a huge impact on a patient's health. Many people think coeliac disease is just a gluten allergy, but it's actually an autoimmune disorder that causes chronic inflammation of the small intestine. The only real treatment for this condition is a strict, lifelong gluten-free diet. Coeliac disease affects 1 in 100 people worldwide. The reality is that many of them don't even know they have it. As healthcare professionals, we will come across this condition in GP clinics, pharmacies, and hospitals. So it's crucial that we understand how to identify, diagnose, and manage it properly. In this video, we're going to cover everything you need to know about coeliac disease. We'll start by looking at what it is, why it happens, and then we'll go through how to diagnose it, including the questions you should ask a patient. After that, we'll explore the role of doctors and pharmacists and how we can support patients and when we should refer them for further testing. Next, we'll move on to treatment options, including the gluten-free diet, supplementation, and medication considerations. Finally, we'll apply everything we've learned to real-life patient cases so you can see how this knowledge is used in clinical practice. If you're a pharmacy or medical student, a young doctor or pharmacist, or just someone interested in how coeliac disease is managed, this video is for you. Let's get started. Alright, coeliac disease. Coeliac disease is an autoimmune condition where the body's immune system mistakenly attacks the small intestines whenever gluten is consumed. This immune reaction damages the intestinal lining, leading to malabsorption of nutrients, and if left untreated, it can result in serious long-term complications. So what exactly is gluten? Gluten is a protein found in wheat, barley, and rye, which means it's present in common foods like bread, pasta, cereals, cakes, and even some processed foods. In people with coeliac disease, gluten triggers an immune response, which causes chronic inflammation in the small intestine. Over time, this destroys the villi, which are the tiny finger-like projections that help absorb nutrients from food. When these villi are damaged, the body can't properly absorb essential nutrients, leading to deficiencies, weight loss, and malnutrition. This is why coeliac disease is much more than just a food intolerance. It's a serious medical condition that can have lifelong effects on a person's health. One of the most important things to understand is that coeliac disease is not the same as a gluten allergy or gluten sensitivity. A gluten allergy is an immune response that can cause hives, swelling, or anaphylaxis, similar to nut allergies. Gluten sensitivity can cause symptoms like bloating and discomfort, but it does not damage the intestines like coeliac disease does. The key difference is that coeliac disease is an autoimmune condition, meaning the immune system attacks the body's own tissues whenever gluten is consumed. Coeliac disease can present in many different ways, and this is one of the reasons it is often misdiagnosed or completely overlooked. The symptoms can be gut related, but they can also affect other parts of the body. First, let's talk about common gastrointestinal symptoms. These are the symptoms that affect the digestive system and are often mistaken for irritable bowel syndrome, also known as IBS. The most common symptom is chronic diarrhea, where the patient has loose, pale, and foul-smelling stools due to poor absorption of fat. Some patients experience abdominal pain and bloating, which can happen every time they eat gluten. Other common digestive symptoms include excess gas and unintentional weight loss due to malabsorption. But coeliac disease isn't just a digestive disorder. It can also cause symptoms that have nothing to do with the gut. Some people present with fatigue and extreme tiredness, which is often due to iron deficiency anemia. Others develop mouth ulcers, which might seem unrelated but are actually a common sign of malabsorption. Some people experience a skin condition called dermatitis herpetiformis, which appears as an itchy, blistering rash. Over time, if coeliac disease goes untreated, it can lead to osteoporosis due to poor absorption of calcium and vitamin D. Some people with coeliac disease also struggle with infertility and recurrent miscarriages, which can be caused by nutrient deficiencies. Interestingly, some people have silent coeliac disease, which means they don't have noticeable symptoms, but their intestines are still being damaged by gluten. This is why screening is important, especially for people with a family history of coeliac disease or other autoimmune diseases such as type 1 diabetes or thyroid disease. If a patient comes into the pharmacy or GP surgery complaining of chronic diarrhea, bloating, and fatigue, we should always consider coeliac disease as a possible cause. But how do we confirm it? We do this by taking a good history and asking the right questions. So what questions should we ask? First, we need to ask about the duration of their symptoms. We can say, how long have you been experiencing these symptoms? If it has been more than 3 months, This increases the likelihood of a chronic condition like celiac disease. Next, we need to ask if they have noticed any specific food triggers. We can ask, do certain foods make your symptoms worse? If they mention that bread, pasta, or cereal seem to trigger their symptoms, this is another important clue. Then we need to ask about unintentional weight loss. We can say, have you lost weight without trying? If the patient has lost weight despite eating regularly, this suggests malabsorption. Another key question is about nutrient deficiencies. We should ask, do you often feel tired? Have you been diagnosed with anemia? Do you get frequent mouth ulcers? These symptoms are all common in celiac disease due to poor absorption of iron, folate, and vitamin B12. We also need to check if they have a family history of celiac disease or autoimmune conditions. We can ask, do you have a family history of celiac disease, type 1 diabetes, or thyroid problems? Since celiac disease is genetic, this can help confirm suspicion. Finally, one of the most important questions is, have you tried eliminating gluten from your diet? And did your symptoms improve? However, we must warn the patient not to eliminate gluten before testing because this can affect the results of celiac blood test. If celiac disease is suspected, the next step is to refer the patient for serological tests, especially anti-TTG and IgA antibodies. If these tests are positive, they will need to do a duodenal biopsy via endoscopy to confirm the diagnosis. Now that we understand how to diagnose celiac disease, let's talk about how to manage it. Unlike many other chronic conditions, celiac disease has no medication to cure it. The only treatment is a strict, lifelong gluten-free diet. This means that patients must completely eliminate gluten from their diet. They cannot eat wheat, barley, or rye in any form. This isn't just about avoiding bread or pasta. It also means being cautious about hidden sources of gluten in processed foods like sauces, soups, and even some medications. Even a small amount of gluten can trigger symptoms and cause long-term damage, even if the patient doesn't feel like any immediate effects take place. That's why it's so important for people with celiac disease to be strict with their diet. Cutting down on gluten is not enough. It has to be completely removed. So, what does the management of celiac disease look like in real life? There are 4 key areas that we need to focus on. These include the gluten-free diet, nutritional deficiencies, referral to specialists, and medication considerations. The most important aspect of treatment is following a strict gluten-free diet for life. Patients need to completely avoid foods that contain wheat, barley, and rye. This includes obvious foods like bread, pasta, and cereals, but also processed foods where gluten might be hidden. One of the best things we can do as healthcare professionals is to educate patients on how to check food labels. Gluten can be present in unexpected places like sauces, gravies, ready meals, and even some sweets. Patients should always look for gluten-free labels when shopping. If they are unsure, checking the ingredients list is essential. Many patients will need additional support from a dietitian, especially when they are first diagnosed. A dietitian can help them understand what foods are safe, how to avoid cross-contamination in the kitchen, and how to maintain a nutritionally balanced diet without gluten. In some areas, gluten-free foods are actually available on prescription, especially for people who struggle to afford them. As pharmacists, we should be aware of local guidelines and advise patients on whether they are eligible. Because celiac disease leads to malabsorption, many patients develop vitamin and mineral deficiencies. Many patients become iron deficient, leading to anemia, which causes fatigue and weakness. They can also develop calcium and vitamin D deficiencies, increasing the risk of osteoporosis and bone fractures. Other common deficiencies include folate, vitamin B12, zinc, and magnesium, all of which are important for immune function and general health. So what should we do about these deficiencies? First, patients should have regular blood tests to check their vitamin and mineral levels. If deficiencies are detected, their doctor may prescribe appropriate supplements. One important thing to remember is that patients should not self-medicate with over-the-counter supplements. Some vitamins and minerals like iron can cause side effects and should only be taken if a deficiency is confirmed. Not every patient with celiac disease will need a referral, but there are certain situations where they must be seen by a doctor or a specialist. A patient should be referred if they have persistent symptoms despite following a gluten-free diet. This may indicate a condition called refractory celiac disease, which is a more severe form that requires specialist treatment. Another reason to refer a patient is if they have unexplained weight loss, severe fatigue, or worsening symptoms. This could mean they have another underlying condition such as IBS, lactose intolerance, or small intestinal bacterial overgrowth. We should also refer patients who show signs of severe malnutrition. If a patient reports symptoms like hair loss, brittle nails, muscle wasting, or frequent infections, this could mean that their body isn't absorbing nutrients properly. They will need further medical evaluation. And finally, some patients struggle with adherence to a gluten-free diet. If they are feeling overwhelmed or unsure about what to eat, they should be referred to a dietitian for further support. One of the biggest challenges for newly diagnosed patients is learning how to completely avoid gluten. It's not just about avoiding bread and pasta. They also need to be careful about cross-contamination in their kitchen. If a family shares a toaster, for example, crumbs from regular bread could contaminate gluten-free bread. Patients should use a separate toaster or toaster bags to avoid this. They should also have separate butter, spreads, and utensils if they live with people who eat gluten. Patients should also be cautious when eating out. Many restaurants offer gluten-free options, but they may not always be strict about cross-contamination. It's always a good idea for patients to ask about preparation methods when dining out. A lot of people don't realize this, but some medications actually contain gluten-based excipients. This means that not all tablets and capsules are safe for celiac patients. If a patient with celiac disease asks, "Does this medication contain gluten?" we should always double check the ingredients or contact the manufacturer. Some liquid medications and dispersible tablets also contain gluten-based stabilizers, so these need to be checked as well. A common scenario in pharmacy is a patient with celiac disease asking for iron, calcium, or vitamin B12 supplements. But should we recommend them? Before we give any supplements, we need to ask a few important questions. We should ask, have you been advised by your GP or dietitian to take the supplements? And have you had any recent blood tests to check for deficiencies? If the patient hasn't had recent blood tests, we should advise them to speak to their GP first before taking any supplements. This is important because some supplements like iron can cause side effects and should only be taken if a deficiency is confirmed. Scenario 1. A 28-year-old female walks into the pharmacy complaining of persistent bloating, diarrhea, and fatigue. She mentions that her symptoms have been going on for the past 6 months and she has lost some weight despite eating regularly. She's noticed that her symptoms seem to worsen after eating foods like pasta and bread. She's wondering if she might have a food intolerance and asks if there's any OTC medications that could help. How should you approach this case? In this case, the patient's symptoms suggest a possible gluten-related disorder, most likely celiac disease. However, we need to rule out other causes such as IBS, lactose intolerance, inflammatory bowel disease, or even a gastrointestinal infection. The best course of action would be to refer the patient to a GP for further testing. The gold standard for diagnosing celiac disease is a blood test for anti-TTG and IgA antibodies. It is important to tell the patient that she should not stop eating gluten before getting tested, as this can produce a false negative result. If the blood test is positive, the diagnosis will need to be confirmed with a duodenal biopsy via endoscopy. Since the patient is experiencing unintentional weight loss, this is a red flag, and further medical evaluation is required. No over-the-counter medication will treat the underlying cause, so she should be encouraged to see her GP as soon as possible. Scenario 2. A 35-year-old male has recently been diagnosed with celiac disease. He comes into the pharmacy looking for advice on how to manage his condition. He's practically worried about what foods he can and cannot eat, and he asks if he needs to take any supplements. He also wants to know if any of his medications might contain gluten. How should you respond? Since the patient has been diagnosed with celiac disease, the only treatment is a strict lifelong gluten-free diet. Even small amounts of gluten can trigger symptoms and cause long-term damage to the intestine, even if the patient doesn't feel immediate effects. You should be advised to avoid foods containing wheat, barley, and rye, including many types of bread, pasta, cereals, and processed foods. You should carefully check food labels for hidden gluten and look for certified gluten-free alternatives. If he eats out, he should ask about cross-contamination risks in restaurants. Regarding supplementation, many celiac patients are deficient in key nutrients such as iron, calcium, vitamin D, and vitamin B12 due to malabsorption. Before starting any supplements, the patient should have a blood test to check if there are any deficiencies. If needed, his GP might prescribe iron supplements for anemia, calcium, and vitamin D for bone health, and folate or B12 if levels are low. It's also important to check that his medications do not contain gluten-based excipients. While most modern medications are gluten-free, some older tablets and dispersible formulations may contain gluten. If he is unsure, he should always check with the pharmacist or the manufacturer. To summarize, celiac disease is an autoimmune condition that requires strict, lifelong adherence to a gluten-free diet. Pharmacists and doctors play a key role in educating patients, checking medications for gluten, and ensuring safe supplementation. Patients should not stop eating gluten before testing, as this can affect their diagnosis. If a patient has persistent symptoms despite following a gluten-free diet, they should be referred to a GP or specialist for further investigation. If you found this video helpful, don't forget to like, subscribe, and drop a comment below. Thanks for watching, and I'll see you in the next one.